Welcome to the Spotlight on Adverse Childhood Experiences, Social and Emotional Development, and Underage Alcohol and Drug Use. My name is Anjali Nandi, and I will lead you through an exploration about what these terms mean and what to do about these situations. Over the past 20 years, I have provided treatment services to folks struggling with addiction, as well as people in trouble with the law. I also serve as a consultant to criminal justice organizations, human service agencies, and treatment providers. The Center for Health and Safety Culture, sponsoring this spotlight, is an interdisciplinary center serving communities and organizations through research, training, and guidance to cultivate healthy and safe cultures. In this spotlight on adverse childhood experiences, my hope is that you will have a better understanding of what these terms mean, the relationship between these adverse childhood experiences and substance misuse, and how strengthening the emotional and social skills of our youth can lessen the negative impact of these experiences and lessen the likelihood of substance misuse. Let's start the spotlight by defining what adverse childhood experiences are. These are negative experiences that can potentially be traumatic or stressful. They're experiences in childhood before the age of 18 and can include abuse or neglect. This can mean physical and sexual abuse, emotional and physical neglect, but it could be even more subtle than that. It could include witnessing domestic violence, or witnessing a separation or divorce of your parents, watching your parents go through a tough process, or living with someone who may be misusing substances, or maybe has a mental health disorder that hasn't really been addressed. Our first childhood experiences can impact us as children in several different ways. These impacts are both short-term and long-term. Some examples of short-term impact include health and physical illness, increased frequency of getting sick. Some social impacts include social withdrawal, reduced social skills, or just a feeling of not belonging. Emotional impacts include depression, anxiety, and higher stress levels in kids. Mental and cognitive impacts include an increased likelihood of mental health diagnoses, inability to concentrate or focus, and getting easily distracted. Those are some examples of short-term consequences as a result of adverse childhood experiences. Some of our long-term adverse childhood experiences impacts go well into adulthood. These include health outcomes like higher rates of obesity, diabetes, heart disease, cancer, and stroke. Increasing the likelihood of engaging in risky behaviors like drug and alcohol use or smoking. Lowered academic achievements, but then also results in lowered achievements at work. And then a reduced life potential. And by that, I mean a reduced graduation rate, reduced academic achievements, even into college, reduced achievements at work, lost time from work because we're sick a lot. These are some examples of long-term consequences as a result of adverse childhood experiences. One of the more worrisome consequences of adverse childhood experiences is higher rates of substance use at a young age. Unfortunately, underage substance use, or using substances, whether it's alcohol or drugs, when we're under the age of 21, is disproportionately more harmful than if we used alcohol or drugs after the age of 21. This disproportionate harm means that when we use a substance as an adult, even though we do suffer negative consequences as a result of it, when we use substances as a child, these harmful effects are exponentially larger. Some examples of these harmful effects are significant and long-lasting effects on the brain, and a greater likelihood of many negative outcomes such as legal involvement, increased likelihood of physical or sexual assault, problems with memory, teenage pregnancy, increased likelihood of STDs, and of course, the increased probability of a fatal accident, including fatal car crashes. So you're probably wondering, well, how do we prevent adverse childhood experiences? So we're going to talk about two things. One is preventing adverse childhood experiences, and then the other is preventing the negative effects of adverse childhood experiences. So one of the primary ways to prevent adverse childhood experiences is to develop safe, stable, and nurturing relationships and environments for children to grow up in. This means several different things. One thing is that we encourage growth. We support new skill building and provide safe and pro-social ways for kids to try new things. Whether it's sports or activities, we send a clear message that children are not born with innate abilities, but they can learn skills through failure and mistakes. This allows for vulnerability and honest conversations. Children also need to grow up in predictable environments. By that we mean that there's very clear structure and clear accountability. Examples of this can include routines or consistent ways of responding to behavior. An inconsistent response would be getting upset with a behavior one day and allowing it or letting it be okay the next. So predictable environments really support stable brain development. It is important to stay present and involved in these safe, stable, and nurturing environments. And by that I mean that every interaction as parents that we have with our children are opportunities to create these nurturing relationships. So another option is to prevent the adverse impact of adverse childhood experiences by focusing on social and emotional development and development of social and emotional skills. So let's start by talking a little bit about what these skills are. These are important, critical life skills. They include skills like knowing ourselves and managing ourselves, and then knowing others and managing our relationship with others. If we are really specific about these skills, one of the skills we talk about is knowing yourself, and that means self-awareness. And this is where it all starts. Some examples of these self-awareness skills are recognizing my emotions, noticing my thoughts and values, and noticing how all of this influences my behavior. This means being able to articulate what my feelings or thoughts are. And once I can do that, we move to the next step, which is self-management. So it starts with self-awareness and then moves to self-management. Self-management is about self-regulation. So once I'm aware of my thoughts and emotions, self-management is about controlling or managing my behavior and managing my impulses. For example, how do I manage stress? How do I motivate myself to keep going when my emotions are really saying, stop, I don't want to do this anymore? So self-awareness is awareness of self and emotions and thoughts. Self-management is then managing those impulses. So we then move to knowing others or understanding what others are really going through. Sometimes we call this social awareness or awareness of other, and it includes skills like empathy or the ability to recognize what somebody is saying or what their emotions are, what they might be feeling, what they might be saying underneath the surface. Sometimes it also means being able to take someone else's perspective or showing respect. So that's the awareness of others. And then the final piece that we talk about is the management of relationship with other people. So this includes some basic skills like communication, being able to listen well, being able to really cooperate and work with other people. But it also includes some more complex and complicated skills like managing conflict, or being able to provide some really tough feedback to people or asking for help when that's what's needed. So some skills are relationship building or communication. It could be conflict engagement. So those are the 4 components that I mentioned: self-awareness, self-management, awareness of other, and management of relationship. And all of this together helps us make responsible and positive choices. So when we talk about social and emotional skill development, we're also talking about responsible decision making. It's these choices that we make about ourselves and about others that influence our outcome. And what we're talking about here is making ethical decisions. We're attending to safety or social norms. We're able to analyze situations, solve problems, and evaluate the most ethical, efficient, and responsible ways of responding to a situation. So social emotional skills can be taught in a variety of situations, but really where they're most easily learned is in interaction, in relationship, in a social context with others, and especially in relationship with our parents. We learn it from school, and we also learn it from our peers. It's definitely a lifelong process, and we're learning it well into adulthood as well. So if I had to give you an example as a child, if we're learning self-management as a child, it might mean waiting my turn. As an adult, it might mean being really upset about something someone said, but not erupting or blowing up at them. Of course, social emotional skill development has a variety of positive outcomes, and these outcomes really attend to some of the negative impacts that are a result of adverse childhood experiences. In the short term, when we develop these social emotional skills with our children or our youth who have experienced adverse childhood experiences, we get some really interesting results. We have fewer conduct problems, whether it's at home or at school. We have lower levels of emotional distress, which means the children are able to manage their emotions really well. They have an increased ability to manage stress. They report lower symptoms of depression and anxiety, and they have a more positive well-being. They do better in school, and more importantly, they lower their use of substance use and substance misuse. And of course, when you lower substance use, you also lower a bunch of other risk factors, like legal involvement, sexually transmitted diseases, exposure to emotional, physical, or sexual abuse. So there are lots of different short-term positive outcomes when we support social emotional skill development, and then these outcomes translate to longer-term outcomes as well. So when we see children who have had adverse childhood experiences and we really support their social emotional development, we end up in the long term supporting them as adults as well. They end up having more stable employment, they do better at work, they make more money, they have lower addiction rates, and since they weren't involved in substance abuse as kids, they're better able to stay out of legal trouble or any additional trouble that substance use creates. Lower instances of them being involved in the legal system might also mean less reliance on public assistance. They also have improved health, better ability to manage stress, and a greater reporting of satisfaction within their personal relationships. So we've talked about a lot today, and have gone over some really deep and important topics. We started with talking about adverse childhood experiences, and we covered consequences of these adverse childhood experiences. We also covered what the short-term and long-term consequences were. One of the consequences of adverse childhood experiences is the increased use of substances, and we talked about what that means and why that's a problem and what we can do about it. One of the things that we discussed in the spotlight was how to prevent adverse childhood experiences. And this means developing safe, stable, and nurturing relationships and environments. But it could also involve preventing the negative impacts of adverse childhood experiences by supporting social and emotional skill development. So we talked about what those are. We discussed some of those skills, and we covered how those incomes are not only profound when they stand on their own, but even more interesting when we provide social and emotional skill development to someone who has experienced adverse childhood experiences. I would like to leave you with a list of resources where you can find additional information on adverse childhood experiences. And feel free to follow us on social media or join our email list for announcements about our upcoming events, as well as our newsletter. Thank you for joining me.